Alrighty. Okay. Hello, everyone. Welcome to the 5th live webinar presentation of the 2022 Hidalgo County Employee Wellness Fair. I will be starting off this webinar with a sound check. If you can hear me clearly, please click the raised hand icon. Again, if you can hear me clearly, please click the raised hand icon. Awesome. Thank you so much. Before we get started, I would like to let everyone know that attendees do not have a microphone feature on this webinar. If you have any questions, please utilize the chat box feature or the Q&A feature, and we will answer questions at the end of the webinar. Our speaker is Erlinda Abantao, CNRN from South Texas Health Systems. Ms. Abantao is a certified neuroscience registered nurse. She is the stroke coordinator of the first comprehensive stroke center in the RGV. Ms. Abantao is a graduate of UTRGV Family Nurse Practitioner Program and joined South Texas Health Systems as a nurse practitioner for endovascular neurology group in 2018 when South Texas Health Systems became CSC certified. Thank you so much, Ms. Abantao, for joining us today.
Good morning, everyone. Thank you for inviting me. I'm filling in for our stroke medical director, Dr. Alexandros Georgiades. I'm apologizing in behalf of him that he cannot make it here today because of some emergencies. Today we're going to talk about stroke awareness. As you all know, it's a Stroke Awareness Month, and I'm hoping I could give you a lot of information regarding stroke to make sure that you control your risk factors and prevent and you all not to be one of my patients. I guess that's what I want to say.
Thank you. You can go ahead and share your screen. Perfect.
Oops. Sorry. So stroke is the number 5 cause of death here in our country. It's the number 1 cause of disability. We spend millions of dollars to take care of our stroke survivors. Every 40 seconds, someone in the United States has a stroke. That means that after my presentation, there would be about 90 people that would have one. There's about 800,000 Americans each year that suffer a new or recurrent stroke. It affects more women than men, about 55,000 more. On average, there's about every 3 minutes and 33 seconds, someone dies of a stroke. It kills nearly 147,000 people a year and about 1 in every 19 deaths. But the good news is 80% of stroke can be prevented. So there are certain populations that are at a higher risk. I want to bring light to the Hispanic and the Latinos, which is 92% of our population in the Rio Grande Valley, right along the border. So the Hispanic and the Latinos have some of the highest rates of high blood pressure, diabetes, and obesity. All of these are risk factors for stroke. So the current data I got is dated 2018 from Texas DSHS. Our area, the region, the health region we belong to, there's about 39.3% prevalence of obesity. Specific to our county, there's about 41.8%. So I think you read it on the newspapers, how we are the unhealthiest area in Texas. That's almost half of our population that are obese. So why is it important to address this? Because obesity can lead to all these risk factors like the high blood pressure, diabetes, and high cholesterol. So what is a stroke? Okay, so a stroke happens when there's actually two different types. The first one I'm going to talk to you all about is ischemic stroke. It happens just like on the picture. If there's a blockage of an artery in the brain. It's about 87% of all strokes. So a clot may be coming from the heart, or it break out from a lining of the artery, travels to the brain, block an artery. Then that part of the brain doesn't get the oxygen and the blood that it needs. And so those brain cells die. So it's one of the most common. Again, 9 out of 10 of strokes are because of a blockage of an artery or an ischemic stroke. So the second type is the hemorrhagic stroke. It's about 10% of all stroke, right? Or 13% of all stroke. See, this one is caused by a rupture of an artery. There can be many causes, but the most common, of course, is high blood pressure. So as you can see here in the picture, it can happen on different parts of the brain, but on this image right here, this is one of the most common places where hemorrhage can happen, usually because of high blood pressure. Now, let's talk about TIA. So TIA is a warning stroke. It's a mini stroke, right? We don't take things for granted if you are a TIA. I should not say you're lucky that you were warned, but it's a warning that something big is going to happen. So if you have a symptom of like not able to speak, not having movement on one side of your body, arm or leg, you started having droopy on your mouth, and then it went away, please don't hesitate at all. Either go to the emergency room right away or get seen by your primary care doctor, because if you've had or having a TIA, seeking immediate medical attention is very important, so we can find out the reason why you had that event. So again, the good news is 80% of the time, strokes are preventable. Actually, 4 out of 5 strokes can be prevented, right? As long as you have these healthy lifestyle changes and you work with your healthcare provider to control all your risk factors, which we'll talk about in a little bit. So very important to know that it can be prevented. So who are at risk? Maybe you have asked yourself, am I one of them? So these are the most common risk factors for stroke. So once you get to be 55 or older, your chance of having a stroke doubles for each decade of your life. If your mom, your dad, your brother or sister had a stroke, keep in mind that you're also at risk for having another one. So Black Americans have a greater risk. Again, women have more strokes than men. It kills more women than men. And if you have a history of stroke, the mini stroke or the warning stroke that I mentioned earlier, or a heart attack, then your risk is pretty high. So you always have to take care of yourself. So when I see patients in the clinic, by the way, I see patients in the hospital, right? As soon as they come into the emergency room, there's this stroke code being called, and I'm part of the team. So I see them in the emergency room, and then I follow them to the ICU. Actually, we help decide on treatment, go to the ICU. Then I also see them in clinic. So in clinic, because sometimes when you encounter these stroke patients in the hospital, too much things are going on and they don't understand all the education that you share with them. So one of the things that I spend time on when I see my patients in the clinic is for them to understand that's one, once you have a stroke, you need to take care of yourself. I always tell them at one point you're going to feel better. You thought nothing happened, right? But it doesn't mean that you have to stop seeing me or your primary care physician. You need to have now regular follow-ups, regular blood work. You want to make sure that you're staying on top of each problem that you have. So I want to share with you what American Heart or American Stroke Association, as part of their program, they have what they call the Embrace Life Simple 7, right? To reduce your risk for stroke, you can take these 7 small steps and it can create big changes. So one of them is get active. What American Heart, American Stroke recommend for good cardiovascular health is a 30 minutes of moderate intensity activity every day, 5 days out of the week. So that's a total of 150 minutes. And if you're doing like running, like you're joining marathons, then you can be doing like 75 minutes of vigorous exercise weekly. The next huge thing is just eat better. Healthy eating is the easiest way to prevent stroke. So this is how I always describe it to my patient. If you see your plate, the carbs on it would be a pretty small portion, right? The big part should be your greens, your yellows, and that's your veggies, and then a little bit of your protein, preferably the white meat protein. As you know, red meat has a higher content of cholesterol compared with white meat. What we want to emphasize on is how to prepare your food. Vegetable oil, you have to be very careful on what kind of vegetable oil you're using. You have to limit the amount of salt that the intake of salt. And remember this, that salt is almost in everything, right? So does your canned foods. So I know we all want to keep canned foods, but the content of salt on canned foods are pretty significant. Any processed meats have a high salt content. So ham, your turkey that you thought would be healthy, just pay attention to the salt content of it. So salt holds water, right? So it doesn't help your blood pressure and it doesn't help your heart. Your heart works harder if you have already risk factors and you still continue to consume high amount of salt. And of course, stay away from salt in the table. You don't want to extra salt anymore. And you want to be very careful with your sodas. Sodas are the highest sugar content food that you can consume. Just pay attention to them and we'll make it simple. Eating better can decrease your risk for stroke. Lose weight. So, and you want to maintain the weight loss. So if you're active, you're eating healthy, losing weight is pretty easy. So I know it's easier said than done. I'm encountering a lot of problems myself. I'm always busy in work, but I try to make it as much as possible to mix either the high impact exercises or the low impact ones, just making sure that I have the 30 minutes every day, 5 days out of the week, exercise, being active. If you are smoking, you better stop smoking right now. It's the #1 risk factor for both heart diseases and neurovascular diseases. You need to control your cholesterol. How would you know if it's controlled, or how would you know if you are, you have any cholesterol problem, is to visit your physician. So I was mentioning earlier that I'm really impressed that the county has this kind of program, right? The other, I think 2 to 3 weeks ago, I was with the Border Patrol, and they have this similar kind of program. And it's very important to create this awareness, because prevention is the key. If you have high blood pressure, number 6, you want to manage it. Part of my stroke education for my patients in the hospital and in the clinic is to monitor your blood pressure every day. Buy that $27, $30 machine that you can get from Walmart, from CVS, from Walgreens, even from Costco. There are things now where you buy this monitor, it checks your blood pressure, and it gets downloaded to an app in your phone. And then when you go visit your physician, your primary care physician, you just pull out your phone, show how it's trending, then we would have a better idea of how your blood pressure has been for the past month since we last saw you. So because your blood pressure in the clinic when you show up, it doesn't tell us much, right? We don't want to change your medication if you have that during that visit you're high. We want to see the trend. So that's recording it, keeping a record of it. You don't have to overdo it. All you have to do is check it once a day. Reducing blood sugar. So when you're diagnosed with diabetes, pre-diabetes, or you have a history of diabetes, part of your wellness visit with your primary care physician should be checking what we call a hemoglobin A1C. So that's blood work telling us what's your average blood sugar for the past 3 months. You don't have to be what do you call this? You don't have to be NPO or not eating after midnight for that blood work. You get it done, and we would see how well you controlled your blood sugar for the past 3 months. So our number target is if you have a history of stroke, you already have you have diabetes, we want it aggressively managed. We want it less than 6.5, but the ideal is you need to be less than 6.1. So reducing blood sugar is very important. So I always tell my patient, I'll try to make it for them easy to understand. So if you have a thicker blood because of high sugar, and comparing it to someone with no diabetes, the flow of the blood in your body, if you have high blood sugar, is slower. If you don't, it's way smoother, right? Think about it, this blood goes to your major organs. So if you have good flow to all your body of this blood, then it gets perfused really well. You get the oxygen that your kidney needs, that your heart needs, that your brain needs. So you won't end up with these problems like high cholesterol, heart problems, or heart attack, or what you call this, a kidney failure. So reducing your blood sugar is a priority for patients with diabetes, especially for those who have history of stroke. But if you can prevent yourself from having diabetes, much better. So I might have forgot to mention that with this presentation, I want to emphasize the 3 points, right? So the point 1 that I mentioned earlier are all about prevention, what you can do to help yourself, the embracing the life 7, right? So I mentioned all the 7. So the point 2 is I want you all to recognize stroke. I want each one of you to know what are the signs and symptoms. What I believe is that if I can teach one of you what are the signs, you probably can help a lot more, because you can tell your family about it, you can tell your friends about it, you can recognize it once your loved one has the stroke. So it's pretty easy. You just need to learn what the FAST acronym means. It's an easy way to remember the sudden signs of a stroke. And if you recognize it, please don't call your aunt, don't call your sister to take you to the hospital, don't call your brother who's at work and that cannot get out until 5. You need to call 911. So this is what FAST stand for. So if you see someone with a facial droop, usually one side of the face, and it's an acute change, that can be a sign of a stroke. If you see someone with arm weakness, usually one side, right or left, as well as leg weakness, right or left, that's an acute change, it's a sign of a stroke. Then you're talking to someone, right? And then you notice that they're not making any sense. Their speech are really slurred or garbled, or they're not able to speak at all, then that's a sign of a stroke. That's the S, the speech difficulty. T means calling 911. Let me tell you why it's important to call 911. Before that, I want to mention that there are other symptoms of stroke that you cannot, a possible stroke that you cannot also ignore. So one of them is sudden numbness, right? So it might not be weak, but he or she, a coworker told you, you know what, suddenly my arm or my leg is feeling heavy, or I have to drag my leg when I'm walking. I was holding a pen and it fell. So those are some of the complaints that you would hear. Sudden confusion or trouble understanding. So one of the stroke symptoms that we really pay attention to is what we call aphasia. So there's 2 types of aphasia, or inability to talk, right? So sometimes they can talk, but they could not understand. We call it receptive aphasia. And those that could not speak is what we call expressive aphasia. So any confusion or trouble understanding can possibly be a sign and symptoms of stroke. So, and then there's another one, complaint. I don't know, a neighbor of yours would tell you that suddenly he cannot see from one of his eyes, or he suddenly got blind and then it went away. So that might be a sign and symptom of strokes too. So you need to get some help right away. Sudden trouble walking. You have balance problems, dizziness, or loss of coordination. So don't want to get really into it, but I want you all to understand that our brain is divided in 2 parts, the anterior part and the posterior part. So posterior circulation stroke are uncommon. It usually happens only like 7% of the time of the 87%. But when your co-worker or your neighbor suddenly told you, hey, I have trouble walking, I felt dizzy, I fell, I'm not as coordinated as I was, then that can be a possible signs and symptoms of stroke. He or she needs to get help right away. Sudden severe headache with no known cause. So most patients with stroke who presents in the emergency room with complaints of a severe headache, usually the worst of their life, are usually a bleeding stroke. It's an emergency, right? So you call 911 right away. So the point 3 that I want to make sure that you all remember after my presentation is that if you think you or your loved one or your neighbor or your coworker is having a stroke, you need to call 911. The T in FAST. Calling 911 means that you're going to get help right away. So you always have to keep this in mind. When I'm waiting for a stroke to come into the emergency room, when a stroke code is being called, usually that might be an ambulance coming in with a stroke behind their truck. So you get help the moment EMTs or the paramedics have seen you either at home or at work. And when they're on their way to the hospital, they activate what they would call it in to the emergency room, letting the physician or the ED team know that they have a stroke behind their ambulance, on their ambulance. And so there's a big team that gets ready. Doctor, nurses, laboratory, x-ray, all of these part of the stroke team include, of course, the neurologists. And one of them is my doctor that I follow, Dr. Georgiadis. So we all get ready. We are waiting for you, okay? So calling 911, you coming in by the ambulance is very important. If you decided to call your mom or your dad or call your sister to bring you on a private car, we don't think it is an emergency until you get seen by a nurse in the triage room, and then they would recognize the stroke symptoms, and then that's when we would say, that's when she would call for a stroke code, and that's when we get ready. Just imagine all the minutes that are wasted, right? Remember this, 1.9 million brain cells die every minute that's passed. Time is of an essence, a huge factor in your recovery for stroke. That's why calling 911 is very important. So why is it that calling 911 so important? Because we can identify right away if you meet the criteria for treatment. So the current treatment is what we call the clot buster, okay? So, I forgot to mention to you all that when you have signs and symptoms of stroke, I think it's on the last, I don't remember where is it, but the most important thing that you don't forget when you experience or when you see someone with a stroke is the time. Knowing when the stroke symptoms started is important. It helps us providers determine if you meet the treatment criteria for the treatment. So one of them is the clot buster, or what we call IV alteplase. So we can only give it to you within 4.5 hours after the symptoms started, right? So let's say you experience the symptoms at 8 o'clock. So you have until 9, 10, 11, 12, 30 where we can screen you if you meet the criteria for the IV alteplase or the clot buster. So this medication, we give it through you IV, we give you a bolus dose, we calculate it by weight, then we give it to you over a minute, and for I don't know if I've mentioned earlier, but neurology has been my expertise all throughout my nursing career until I became a nurse practitioner. So I've seen many classic effect of this drug, right? Someone come in with not able to talk. And as soon as we give the IV alteplase, you can see the changes right away or the improvement just within minutes. So what it does, it dissolves the clot that causes the blockage of an artery. So, but we have this limited time window to administer it to you. So that's why quick treatment means less brain damage. Remember what I said earlier, 1.9 million of brain cells die every minute that passed after your stroke symptoms started. So then let me talk about the other treatment that's available, which is called mechanical thrombectomy. So now, so back in 2012, I was in Valley Baptist. We started, I met Dr. Amir Hassan for the first time, and he is the first endovascular neurologist here in the Valley. He was the one who started a program in Valley Baptist. And so I've seen this happen for the first time, and I was so amazed. So he goes into an artery in the groin, goes in with the catheter, go to the artery where there's a blockage, and then he deploys the stent, and then he captures the clot, right? And then he pulls it out. And then you can see the artery open up, and that part of the brain that did not get blood supply starts perfusing. So sometimes you see this classic improvement right there on the table. Patient who doesn't talk suddenly is screaming because he's in pain. So this type of procedure can be done up to 24 hours after stroke begins. But I don't want you to wait for the 24 hours, right? Showing up in the hospital means you're getting the help quicker, which means that less of your brain cells die, so your outcome is going to be much better. So those are the two treatments that are available for acute ischemic stroke at this time. And why do I emphasize on ischemic stroke? Remember that 87% of stroke is all about ischemia, not getting the artery being blocked and not getting the blood and the oxygen that your brain needs to a certain part of your brain. So can these two treatments be combined together? Yes, it is. We can give you alteplase, and if that clot is still there, you did not improve, then the doctor can go in and remove that clot. So that's the treatment. Well, I want to talk about cool stuff now, right? So let me tell you about my patient. He's a 58-year-old engineer. Him and his spouse was working somewhere else, out of town, I believe. And he's, by the way, a Hispanic male. Have never seen a doctor. He thinks he was healthy. So him and his spouse talked over the phone around 10 o'clock. And everything was well. By the way, he works, I believe, virtually. So during the pandemic. So he called, they talked and everything was well. And then at 11 o'clock, the spouse got a phone call from him. And she could not understand anything that he was saying. Spouse got worried, called 911, told them that her husband is alone at home, and she thinks that he has a stroke. So when he presented in the emergency room, it was just like an hour and 30 minutes from his last known well time. So we used the 10 o'clock to identify the time that the patient was still at his baseline or at his normal. So at 11:30 when he arrived, his stroke symptoms happened an hour and a half ago. So he meets criteria for the clot buster. So the CT head, which I don't have here in the picture, showed that there was no evidence of bleeding. So we gave him the clot buster. But after the clot buster medication, his symptoms did not improve. And he's still showing signs of what we call a large vessel occlusion. So when an artery in the brain get occluded, a big one get occluded, what we see is significant signs and symptoms of stroke. He cannot move his left side. He has a droopy mouth. When I saw him in the emergency room, and he has this slurred speech I barely could not understand. And he cannot, every time I stand on his left side, he's turning his head away. We call it a neglect. And that tells me there's a large vessel occlusion. So we did what we call an advanced neuroimaging. So we did a CT perfusion of the brain. CT perfusion of the brain is one of, by the way, what I forgot to mention earlier is that when you have signs and symptoms of stroke, it's very important that the ambulance would drop you off on the right hospital, right? We have now the acute ready hospital. You have the primary stroke hospital, stroke center, and then you have what we call the comprehensive stroke center. So we have 3 now here in the Valley. Back in 2012, we only have 1 in Cameron County. Now there's 2 here in Hidalgo County. So I felt so bad before, right? Because anyone who has stroke here in the McAllen area, it would take them a while to go to Harlingen to get the help. So, but now, for the past, I don't know how many years, we have these 2 comprehensive stroke centers in Hidalgo. So why do I mention this? Because only the comprehensive stroke centers have this ability to do this test that I'm showing you right now on the slides. So the CT perfusion is a way for the provider to know how much dead brain tissue there is. So what you see on the red on the top are dead brain tissue already. It's calculated at 64 cc's, and then the one that is green, it's calculated as 206. So we deduct the 64 from the 206. It's telling us that we have still 142 cc of brain that we can save. So that means that even though he got the TPA, it did not open the whole artery. So now we can do what we call the mechanical thrombectomy. So the next test that we do is what we call the CT angiography of the head. So what you see in the picture with the red arrow is an artery that is occluded. It's supposed to have the same branches on the left side, but the right side, there's an occluded artery. And then you have what we call the CT angiography of the neck, which tells us that there's one artery there where the blue arrow is that is missing. If you look at the left side, you can see that it goes all the way up to the brain, but the other side, it cuts off somewhere. So that tells us that a large artery is occluded. So when we did the angiography, so in the second floor here in McAllen Medical, where we do the procedures, we do this cool stuff. It's called cerebral angiography. We have this $1 million machine where we can look at your vessels and see clearly what we saw on the non-invasive imaging. So on this, it confirmed that his right carotid artery is occluded. Dr. Georgiadis was able to open up the artery with the balloon. So you can see now that the artery, the second picture, that the artery now is open up all the way to the brain. But once he got into the brain, he saw that there was another artery that's occluded. So you can see that another artery inside the brain, he was able to open it up. I'm sorry, he did a mechanical thrombectomy. He went in with a stent retriever, removed the clot, and then afterwards you can see how the brain now, how the vessels now is perfusing the brain. So on the picture down below, I made it a little because I don't want to scare everyone, but that's a stent retriever with a clot on it, the one that he took out from this 58-year-old male. So did everything that we did was successful? Yes. So if you look at the MRI of the brain, the patient only suffered a small amount of stroke. Good news is he's back working as an engineer. So that's one thing that I want for you all to remember after this presentation. I know prevention is the key, and that's your priority. You need to embrace all those life 7. But I want also for you all to know that in case you have a stroke, and once you recognize it, there are hospitals here in the Valley that can help you out. It's just all about getting there on time. So talking to your doctor about your stroke risk are very important. So for our 58-year-old male engineer, he has an undiagnosed high blood pressure. He smokes. He was undiagnosed diabetes and high cholesterol. So high blood pressure is the #1 cause of stroke and the most important controllable risk factor, right? It's common for patients who are overweight or obese, over age 35, have a family history. Sometimes pregnant women are at risk for high blood pressure. Those that are inactive, eat too much salt, or consume too much alcohol. More than 20% are unaware that they have high blood pressure. So our 58-year-old engineer was one of them. So how can you control your blood pressure? It's a repeat of what I said earlier about the life 7. Eat a better diet, reduce your salt intake, physical activity, healthy weight, manage your stress. I believe as Hidalgo County employees, most of you are exposed to this stress, right? So please just make sure to find a way to decrease that exposure to stress, okay? Do your distressing. Some of you all might be exercising regularly. That's a good distressing activity. Avoid tobacco smoke, okay? So stop smoking. Take your medication as prescribed. And Dr. Georgiadis would always say, Erlinda, telling your patient that they could not drink is just sometimes impossible, right? So guys, I know the goal is for you not to drink alcohol, but if you all do, limit your intake. No more than 1 drink per day for women and 2 drinks per day for men. I've already mentioned the importance of stopping smoking, diabetes. I mentioned it to you earlier. Good blood sugar control is very, very important. Mentioned the physical inactivity and obesity as one of the risk factors for stroke. Also the high cholesterol. So when we look at cholesterol results, we look at 2 most important ones, right? The good and the bad cholesterol. What we know is that if you have good cholesterol, the HDL, it seems like your bad cholesterol is lower. So it's all about the food that you eat, the healthy eating, the kind of food that you eat that has good cholesterol on it. So I don't know if any one of you all have been diagnosed with atrial fibrillation or abnormal heartbeat. So what happens when you have atrial fibrillation is your heart is quivering, right? It doesn't have time to empty from one chamber to the other. Then what happens is it doesn't have time to empty from one chamber to the other. So the ones that pulled on the bottom form little clots, and then the moment that on the next heartbeat, that clot can go to the brain and block an artery. So discuss with your cardiologist, do you need to be on a blood thinner? Or is it safe for you to be on blood thinner? And if you are taking blood thinner, the strong one, the atrial, the anticoagulants, every time you have a procedure and it's your surgeon say you need to stop taking that blood thinner, make sure you get a clearance from your cardiologist or neurologist. Other heart disease, what we know, if you have a weak heart, you have congenital heart defects, you have valve problems, your risk for stroke is higher compared to others. And if you have problems with the circulation of the leg, what we know is that you might be also having what we call a carotid artery disease, which is one of the most common conditions that we see here in the Valley. So I have a 73-year-old patient, a very healthy man, and told me the other day, he was here in the clinic, that so my neighbor noticed me that I am having problems with my speech, that sometimes it's slurred, and that sometimes she thinks that I don't make sense. So I went to McAllen Heart Hospital, got seen by an ED doctor, had a workup done, and he found out that I have a left artery carotid that is occluded 70 to 80%. So good thing, right? He still did not have a stroke, a full-blown stroke. He had what we call a TIA. He got help right away, and right now he's having that procedure done where Dr. Georgiadis go in. He sees that 70 to 80% occluded left carotid artery, and then he opens it up with a stent. So if you have a known carotid artery disease, make sure you get a regular follow-up with your physician. So South Texas Health System, which I'm a part of, the Neuroscience and Stroke Institute, as part of a celebration for the National Stroke Awareness Month, which is May, have what we call the Steps for Stroke. Kindly visit the page, in the web page for it. I'm hoping you can all join us. It's the one of Life 7, right? Be active. So they have this program that they offer that starts next week, or May 21 is when it starts. So question and answer time. Oh, I'm over 2 minutes. So I have 15 minutes to answer any questions.
Perfect. No, you're perfect. Okay, let me go ahead and share my screen again. And alrighty, so we'll get the Q&A started. So one of our questions that we had from a couple of our attendees is, what is the youngest age that you can have a stroke?
Ooh, it can be, so the youngest, my experience has been 13 years old. Okay. I have a 13-year-old who has what we call a hemorrhagic stroke. He had an arteriovenous malformation, and while in school, it ruptured and caused hemorrhage to his brain. Good news is he's back in school and get back to his normal activities now. But I want you all to know that stroke can happen from 0 to 99 years old. So we have heard about newborns having stroke, but myself, the youngest patient that I have is a 13-year-old teenager who did pretty well.
Wow. Okay. Thank you for that. So somebody else asked, what are the chances of going back to normal, once you've experienced a stroke and a vessel has collapsed?
Okay. So it's all about the amount of brain that died after a stroke, right? Many factors in between. Age is also a biggest factor. So if you have a small stroke, you are 40 years old, What we found out is that if you have right-sided weakness with intensive rehab, you can go back to almost normal. So we have many of those patients. So when I take care of 34, 58 years old or 85 years old, what I see is that if you are younger and you have a stroke, your chances for recovery seem to be look more optimistic with intensive rehabilitation and close, constant visit to your physicians, where we can stay on top of your problem. And what I want to mention is family support, right? What we found out is that your recovery is way better when you have loved ones who's taking care of you. I always see it here in the clinic. So there's many factors. To answer your question, there's many factors that could contribute to the recovery of a patient. But the first thing is, how big is the stroke? How old is he? And how much support does he get after recovery?
Right. So definitely a lot of factors there. Yeah.
Yes.
Somebody else asked, can baby aspirin be taken to prevent stroke even if you don't have high blood pressure and diabetes?
Okay. So, wow. Anyway, same question from the Border Patrol guys. Can I just
Oh, really?
81 milligram? So this is what I always say. If you're healthy, you have what we call the wellness visit with your family physician, right? Once you get identified to have one of the risk factors, we encourage you to be taking aspirin 81 milligram. Can you just take it? Well, it's an over-the-counter, but you have to keep in mind that aspirin is not too friendly to our stomach. So if you want to take it, you want to make sure that you don't have any ulcers on your stomach. You get the ones that enteric coated. You don't have any history of bleeding. But what I recommend as a nurse practitioner working for a long time taking care of strokes, get seen by your primary care physician before you start on any type of medication.
Absolutely. Awesome. Thank you. A couple more questions. So somebody asked, you mentioned a couple of different procedures that can be done once somebody has a stroke to identify where that blockage is and where you would need to open up that artery.
Yes.
But can these procedures be requested just as preventative measures if somebody does have diabetes and high blood pressure?
Unfortunately not. Okay, so one thing we want to make sure we start, we need to do cost effectiveness is really important with the care, with stroke care, right? This kind of procedure costs a lot of money. So we start with non-invasive imaging if you have risk factors. So one of the things that your primary care physician might order is you probably need carotid ultrasound, right? Because when I listen to your neck vessel, I could hear this abnormal sound. So we start with the non-invasive, which is carotid ultrasound. Based on those results, we can order another non-invasive imaging, especially if you're experiencing problems caused by that blockage. And then you get to be referred to our clinic for if those non-invasive imaging showed that you have some type of narrowing or stenosis, then Dr. Georgiadis can, of course, do this cerebral angiography procedure as an outpatient anytime.
Okay, wonderful. Thank you. And then just one more question. What is the likelihood of eliminating high blood pressure once you have it?
The life 7, right? The first 3 is very important. Be active, okay? Start slow is what I would say. If you already have risk factors, you have diabetes, you have high cholesterol, you have a high blood pressure, you want to start slow. So I always tell my patient, go to the park. If you do half a mile today, do half a mile for the whole week. Then the next week, try to advance more. When you can do a mile, that's pretty awesome, right? So you always want to start slow on being active. The goal is consistency on the 30 minutes, right?
Mhm.
You cannot be doing it this week and then the following week you're not going to do it. So it's all about consistency. Eating healthy, okay? Salt is what we know is that once you control your weight, you're eating healthy, you're active, some of our patients can be off the medication.
Oh, wow. Okay. Well, wonderful. Well, thank you so much, Ms. Abantao, for your very informative presentation. I know a lot of our employees really were able to get some great information from it, and they're all over the chat saying that they really enjoyed it. So, well, that was really awesome. Thank you, everyone, for your participation. This does conclude our fifth webinar of the 2022 Hidalgo County Employee Wellness Fair. Be sure to check out the rest of our online platform or join us in person at the Precinct 2 Indoor Sports Complex in FAR. If you have any questions, message us through our chat feature or email us at hidalgocounty.wellness@co.hidalgo.tx.us. Thank you, and we'll see you very soon. Thank you so much, Ms. Abantao.
Thank you so much.
Have a good day.
You too.
Thank you.